Hello, welcome to Medicine and Medical Nursing. Today's topic is health assessment. Health assessment refers to the process of obtaining data or information from the patient. Now, the information that is supposed to be collected from the patient has to be complete. So under health assessment, we're going to look at history taking and physical examination. Now this video aims at looking at history taking, and then in the next video we'll look at physical examination. History taking, this one, it is also referred to as a clinical interview. It is the major component of health assessment. It is the first thing done to find out why the patient comes to the health facility. Now, history taking is a planned discussion that is aimed at establishing the health needs and health problems of the client. It is normally conducted before physical assessment. So history taking is done before you do any physical assessment. Now, during history taking, you should collect the following information: demographic data. Under this demographic data, we have examples such as age, sex, address, marital status. We'll come into that later. Then you should also collect information on presenting complaints, the issue of presenting illness, issue of previous illness, treatment history, family history, and social and occupational history. Let us look at the information that you should collect under history taking in details. So for demographic history, this one, demographic history or biographic data, under this heading you need to collect the following information and record: name of the client, age, sex, address, that is the residential address of the client, the marital status, are they married, are they single, are they divorced, that is important information, next of kin, religion, denomination, nationality, tribe, and occupation. So those are the things that you need to get from the client under demographic or biographic data. And then the presenting complaints. The presenting complaint is simply the problem which made the patient seek medical help. Try to define the main complaint and its duration. The timing and duration of symptomatic events is especially important, since the order of the illness will provide valuable clues to the pathological process underlying it. Some patients might find it difficult to remember the exact duration of their illness, especially the elderly. This is normal. Some will use events to signify the duration. So you need to ask the client or the patient when last they felt perfectly well. This may help the patient to remember earlier symptoms which he or she may have thought as unimportant. Then we've come to history of presenting illness. Under this heading, you need to ask the patient to tell you the story of the illness from the beginning. Ideally, you should allow the patient to continue without interruption. If the patient is anxious or nervous, you need to use tactful encouragement. For talkative patients, try to direct their account of events. Some patients use medical terminologies without knowing their meaning. Encourage such patients to tell you what they actually feel to be wrong. Friends or relatives may accompany the patient. Always talk to the patient first. When the patient has given you an initial description of their symptoms, suggest that you would like to find out more about certain aspects. Try to clear up doubts about the time of onset and duration of the main symptoms. Some symptoms come and go. Then try to find out whether the relapses and remissions are related in any way to times, seasons, or events in the patient's life. After the patient's story is clearly understood, examine each symptom in detail. Now, we have what we call a symptom analysis. For example, pain is a symptom which can be explored in clinical terms in order to direct physical examination and then clinical investigation toward description of the cause of the pain and its treatment. Other symptoms may be physiological basis and thus can be considered more specifically. Now, in symptom analysis, it is important to consider the cause or shape of illness, reason for presentation, and finally review the systems. Now, for example, to conduct an analysis of pain, you need to consider the following and ask your client these questions. You need to start first of all with onset. Under onset, you ask the patient questions like, when did the pain start? We have another heading such as location. Under this heading, you ask the client or the patient, where is the pain? Another heading, duration. The questions that you can ask under this heading is, for how long have you been feeling that pain? When did it start? We have another heading, characteristics. How is the pain? Is it stabbing, burning, or pricking? Is it localized or it originates from a certain body part and moves to other parts? Another heading under this same symptom analysis is aggravating factors. You ask questions like, what worsens the pain? Does it worsen when you cough or when you breathe? We also have another heading known as relieving factors. Here you ask the patient what lessens or what reduces the pain. And the last heading that we have is treatment. What drugs or treatments are you receiving? Now, to help you understand the components of the symptom analysis, you may use this mnemonic, ODCAT. That is O L D C A R T. So O stands for onset of illness, L stands for location, D for duration, C characteristics, A aggravating factors, R relieving factors, T treatment. Okay. Now we've come to history of previous illness. History of previous illness. Now, evaluation of the previous history will help you to get an insight about the health status of the patient. The previous history should include all important illnesses, operations, and injuries from infancy onwards. Ask questions about the nature of the illness to check whether the diagnosis seems likely. Inquire about treatment for the previous illness. Ask about previous admissions to hospital. Family history. Family history. Under family history, you need to know that it is very important to evaluate the family history of your client. Evaluation of family history will help you to determine the health of the immediate family members. It will also help you to know whether your client is at risk of developing certain conditions which run in families. Now, note the patient's position in the family and the age of the siblings or children, if any. Record the state of the health, important illnesses, and the cause of death of immediate relatives. Inquire about genetic disorders in the family. Ask if there is any family member with similar symptoms. Social history. Under social history, the patient's physical and emotional environment, including their surroundings both at home and work, and their habits and mental attitude to life and to work, are very important components of the health history that are important in assessing the effects of the illness on the patient and on their family. Ask your patient questions such as, what do you do during your spare time? Do you take alcohol? Do you smoke? Do you exercise? That is under history taking. Then occupation history or occupational history. Certain occupations may predispose to conditions such as prolonged exposure to radiations may lead to cancers. Ask your client whether he or she has been exposed to noxious substances at work, number of work hours, nature of work. For example, secretary, director, underground mine worker, street vendor, barman, shop assistant, or nursery nurse. Okay. Now, we also have other types of history, that is menstrual history. For this one, you ask the women about their menstruation, that is the last normal menstrual period, the regularity, the duration, the amount of flow, and the menstrual tension, the issue of taking oral contraceptives or contraceptions. Okay. Now, this brings us to the end of history taking. Our next video will be on physical examination.